My name is Angela Ruggiero, and I wanted just to tell everyone my story, my history. I have endometriosis. I was diagnosed in 2012, and I was diagnosed through an ultrasound, and they saw that I had a cyst on my ovary, and I also had rectal pain associated with that as well, and pelvic pain. So the ovary was the reason why I was having that rectal pain. So talked to the doctor. They said, hey, we need to get it out, and in order for us to really diagnose you for endometriosis, we got to go in. We got to see. So I said, hey, you're the doctor. You know what you're doing. Let's go in. Take it out. They took it out. I thought I was going to be better. I thought everything was going to be solved. But I was not better. I was worse. I couldn't enjoy life. I couldn't be active. I suffered from a lot of fatigue. My whole entire abdominal area, uterine area, pelvic area, tailbone, everything just hurt. Everything was stuck. Everything wouldn't move right. Digestion was hard. Muscles in the diaphragm, muscles on the side of my stomach would just tense up and seize up to a point where if I went outside for just a walk, and a very light walk, 30 minutes, I would feel like a truck just ran me over. So that's how bad it was. Whenever I had bowel movements, they were worse. Whenever I would go to empty out my bladder, it was worse, where it was to a point where I couldn't get the stream I couldn't empty out all the way. Yeah, so I was pretty much in pain every hour of the day. I knew that manual manipulation is what I needed because one time I was just really nauseous, and I just ended up started massaging like the top of my stomach. I just massaged it and I'm like, oh wow, my nausea went away. Because stretching wasn't working. That was the only thing that kind of gave me relief. Went to a physical therapist that they recommended, who did not do any manual work. They just made me do stretching. And I'm looking up online and doing my own research. Okay, what do I need to do? Because I intuitively know that I had scar tissue and that I needed to manually rip it apart or massage it. So I had to basically go on my own journey to find someone who would manually help me with my scar tissue. And then now it's 2019, and it took me that long, I think 15 years, for me to find clear passages to help me with my scar tissue. So I just felt, for 15 years, I just felt crazy. I felt lost. I felt like, what's wrong with me? Why can't I get better? My family members didn't understand. They never experienced, the level of pain that or any complications from anything, so they couldn't understand why I couldn't get better. I couldn't eat anything because everything I ate would cause so much cramping that I felt needles everywhere. And I never understood why I felt needles everywhere. Like every movement of the food in my intestines, like I could feel it with needles. And can you imagine like having your food just digest throughout the day and then you're just feeling pain? Another symptom I was experiencing after surgery was painful intercourse. Intercourse was already a little painful for me before surgery, but it was manageable. Like it was a little painful, but it was like okay, and then it was okay. After surgery, intercourse was painful. It was unbearable at times. He's a very understanding, person, and I'm very blessed to have a husband who's very understanding and supportive. But what couple doesn't want to be able to be intimate together? I was going to a specialist in Atlanta, and they heard about the clear passage from their patients and from word of mouth that, hey, clear passage is a great place that specializes in scar tissue, and then also specializes in endometriosis and the scar tissue that the adhesions create. You should check them out because I think you're a good candidate. So that's when I looked you guys up on the internet, and I looked at your website, and I saw you guys had just a page on endometriosis, and I was like, oh, praise Jesus, because I've never seen anything like that. I've never seen the research and the all the information that you guys have in your website. I've never seen anything like that on anyone's website. Day one, I was able to go for a walk and not have pain in my rectal area. Day one. Okay? Being able to walk and have my pelvic area just be so loose and just move and not have to hear popping and like feel like aching and not have my rectum just ache and pain. And being able to, like, in the middle of the week, being able, after having more work done, being able to sit comfortably on my tailbone, on my my butt bones, being able to just sit there and be like, oh, this is what a normal person feels like. And I just feel my movement more comfortable. I'm not used, since the surgery, I'm not used to being able to go and walk. But now I'm able to go on these, like every day I walk an hour. After my walk, I don't feel like a truck has come and hit me. I feel like, oh, I just went for a walk. With a few sessions with the therapist and doing internal work, where the therapist was able to go inside the vagina and go inside my cervix and feel where the scar tissue was and loosen that up. After that work, the second time it was done, my husband and I were able to have intercourse for the first time in so many years without me having pain. Being able to do that now, it's like, oh my God, I don't have to feel scared or have anxiety now whenever we have to try to have a baby. So I'm very hopeful to now being able to have a more active life. Yeah, and the tools and the techniques that the therapist showed me, and it's going to help a lot because I'll be able to keep everything kind of loose and moving with the techniques that they taught me. I want to cry, but I don't. I feel like it's a dream, because I feel like that you guys have heard me, and I feel that you tied what was going on in my anatomy to my symptoms, because no one was able to do that. After 15 years of just going to doctor to doctor to doctor, not one person was able to say, hey, maybe it's scar tissue. Hey, you're not crazy. We know what you're going through, and let's figure it out. Not one. It felt like, hey, I'm not crazy. Hey, like almost like a liberation, like, wow, I can have my life back. Like someone heard me. There's so many specialists I went to, and so many therapists, so many physical therapists, so many massage therapists, so many doctors, so many, you name it, and none of them were really able to help me. None of them were really understood. But the technique that you guys do works, and having the therapist show me that technique so that I can help myself every day makes sense. And I intuitively knew I had to manually do something with my muscles. I just didn't know how. And I know from experience that with Clear Passage, you come here and they care about you. You come here and they give you the treatment that they promise that they're going to give you. So that's why I came to the Clear Passages. Yeah.